Other big news that's happening right now, the health department is pulling the plug on $500 million in funding specifically for mRNA vaccine development. Health Secretary Robert F. Kennedy Jr. calling the technology behind current COVID and RSV vaccines, quote, ineffective. Take a listen.
mRNA vaccines don't perform well against viruses that infect the upper respiratory tract. mRNA only codes for a small part of the viral proteins, usually a single antigen. One mutation and the vaccine becomes ineffective.
Scientists and vaccine experts are now coming out against this decision. They say mRNA vaccines are a safe and effective way to fight against rapidly changing infections, and that cutting this research could put people at more risk during public health emergencies. NBC News health reporter Aria Bendix following all of this for us. So, Aria, RFK Jr. says there is more risk than benefits when it comes to these mRNA vaccines, but we've seen multiple studies, and we actually all lived through a pandemic where an mRNA vaccine actually was developed very quickly, in 1/10 of the time it takes for a normal vaccine to be developed. So is there evidence to back up the health secretary's claims?
Unfortunately, not really. What the secretary is essentially saying here is that mRNA technology doesn't offer sufficient protection against things like COVID and flu, and that these vaccines could be rendered ineffective by a single mutation. We just don't see that, right? We know that these vaccines have been extremely effective against hospitalizations and deaths, preventing those, even if they don't prevent infections. And we know that these viruses have not mutated to the point where these vaccines are not working. They are indeed working. So the experts I talked to say that Kennedy just fundamentally is mischaracterizing the science here.
So the flexibility of the mRNA footprint is the point, right? And so what types of diseases would these vaccines typically be associated with, where the funding is being pulled? Do we have a sense of that?
Yeah, so these terminated contracts are really focused on mRNA technology for COVID and flu shots. Obviously, those are the viruses with some of the biggest pandemic potential. Also the viruses that are responsible for the respiratory infections that we see every year. So this new research could have gone towards developing newer, better versions of these shots, maybe ones that don't involve needles or combine COVID and flu vaccines. That's really important when we think especially about the next pandemic. How can we use this research? One expert told me it's like cutting the entire fire department because there's no active fire. We know there will be, and you want to be prepared when it happens.
That's an interesting analogy. So, Aria, this is all happening amidst what appears to be an anti-vaccine push from Secretary Kennedy there. So he recently also gutted a pretty crucial advisory committee, a vaccine advisory committee at the CDC. Walk us through what happened there.
Right. So the experts I talked to are really worried about the secretary trying to whittle away at the U.S. vaccine infrastructure under the guise of safety. We've seen him pull $2 million from a vaccine program for vulnerable children. As you mentioned, the vaccine advisory committee to the CDC was gutted and then replaced. That group ultimately voted to pull certain flu shots from the market that contained a preservative that we know is safe. So all of this leads to long-term concerns about sowing doubt in the safety of our vaccines and maybe preventing scientists from even developing newer, better ones.
Are we going to see shortages in flu vaccines?
Not at this point, no. These are hypothetical concerns, but very real and should be taken seriously.
The scariest thing you said is about the potential for the next pandemic.
Exactly.
Not the resources that we need. Thank you very much.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.